Yet more evidence today of the pressure on the NHS in England. The number of people waiting for routine hospital treatment has risen to a new record. It now stands at 6.2 million people. And over 22,000 patients in accident and emergency had to wait 12 hours or more for a bed after being admitted. Our health editor Hugh Pym reports.
The emergency department at University Hospital Coventry today, they say it's never been busier. Some sick patients are enduring long waits on trolleys before beds in the wards can be found.
Gentleman in his 80s who's been here since 2:59 yesterday afternoon.
Ed, who's a senior consultant in the department, says the trend is worrying.
We never used to have patients wait more than 12 hours in the department, and 98% of our patients would have been seen and treated within 4 hours. Now it's not extraordinary.
It's a familiar story in most hospitals. More patients coming in, delays discharging those who are fit to leave, as well as COVID. At a different hospital, Jean, who's 87 and has complex medical conditions, had to wait more than 30 hours in A&E for a bed to be found. Her son Andy describes the scene when he was allowed to see her.
There were patients on ambulance trolleys literally everywhere, stacked in the centre of the A&E department, down the corridors to the A&E department, and the staff were absolutely rushed off their feet. Mum and Dad.
Nottingham University Hospitals Trust apologised for the delay to Jean's care. They said demand at the time was unprecedented.
You see your life going past. When was the last time I was able to go for a good walk on the moors?
Terry from Derbyshire doesn't need emergency care, but she's been waiting more than a year for 2 partial knee replacements, and it's made her job in the NHS a lot more difficult.
Working as a midwife, I had to go off sick because I couldn't manage the ward work. I was in tears trying to get back to the car, only being able to shuffle along.
Back in Coventry, they've managed to cut some of the long waits for planned operations.
I'm proud to say we don't have any patients who are now waiting more than 2 years. And our ambition now is to work on those patients waiting more than a year. And we want to get that down to 0 as quickly as possible, and hopefully by the end of this year. It is a significant challenge.
In Coventry, there are COVID patients in wards like this, nearly as many as during the peak of the Omicron surge over the winter. Most are here because they have other conditions, but that still creates challenges for staff in the hospital. COVID infections in the community are falling according to the latest survey, but NHS staff know the virus, along with many other pressures, won't go away. Hugh Pym, BBC News, Coventry.